Today my topic of discussion is microcytic anemia. First of all, what is anemia? Anemia means when the hemoglobin is low, there is a standard hemoglobin as per WHO criteria. If hemoglobin amount is low compared to the WHO standard, then it is called anemia. For healthy man, it is less than 13. For healthy woman, non-pregnant, it is less than 12, and for pregnant woman it is less than 11, which is the definition of anemia. So many of us are suffering from anemia. In India, as per the last National Family Health Survey, more than 65% population are suffering from anemia. Now, how we diagnose anemia? First, the patient suffers from some symptom, like they can feel weakness, dizziness, repeated infections, tiredness. So if these symptoms are there, then the patient should go to a doctor to look for whether there is an anemia or not. But if there is anemia, then we need to find out the cause of anemia. A particular type of anemia is microcytic anemia. That means when the red blood cell size is smaller. Then what are the conditions where we can get a microcytic anemia? The most common cause is iron deficiency anemia, and in our country the most common cause of anemia is also iron deficiency. The cause of iron deficiency is nutritional, and the cause of blood loss. The most common cause of iron deficiency in our country is blood loss. That blood loss may be because of worm infestations if the people walk barefoot, or maybe blood loss from stool, like patients may suffer from piles, or increased blood loss during menstrual cycle. So these two are the common causes of blood loss. One is blood loss during menstrual cycle, and second is blood loss from the gastrointestinal tract. It may be gastric ulcer, it may be gastritis or piles, something like that. Now we need to find out the cause, and that can be identified some iron profile test, which includes ferritin, serum iron, and total iron binding capacity, or TIBC. By doing this test, iron profile, we can identify the iron deficiency. We should treat the iron deficiency by giving iron supplementation. It may be oral iron supplementation, and if there is severe anemia less than 7, we can supplement the iron by giving intravenous iron also. If there is any urgency of iron replenishment, like during the later part of pregnancy, then also intravenous iron needs to be given. Another cause of microcytic anemia is thalassemia. In our country, especially in some states like eastern region state or northeastern states, the possibility of thalassemias are very high. Many of the people are having thalassemia carrier also. Although thalassemia carrier is not a disorder, but they may have a mild anemia with microcytosis. And thalassemia, we know, is a genetic disease. In thalassemia, patients needs regular blood transfusion, and in thalassemia also we can get a microcytic anemia. How can we know whether it is microcytic or normocytic or macrocytic? By seeing a blood picture which is called complete blood count, which is done in the automated cell counter. And in automated cell counter, if the RBC volume is less, then there is it is called microcytic hypochromic anemia, and then we need to diagnose whether it is an iron deficiency or thalassemia or related disorder. After the proper diagnosis, appropriate management needs to be given. But if the patient is diagnosed with microcytic anemia, they should go to hematologist for the proper diagnosis and proper management, because the managements, although all these are microcytic anemia, the management is different. In iron deficiency anemia, we should treat with iron supplementation, but in thalassemia, the iron supplementation is contraindicated. It can cause more harm if we give iron in thalassemia patients. So proper diagnosis by doing either iron profile or hemoglobin HPLC, and then appropriate treatment needs to be given. Thank you.